Hi, my name is Dawn. I'm going to be your nurse today. I'm just going to close the curtain for privacy. Okay? How are you today?
I'm doing great.
Okay. How is your mood today?
Good. I'm feeling really good. Happy,
Okay.
not anxious.
Okay. Can you tell me your name and date of birth?
Christina Conaway, 6485.
Okay. Let's see here. Okay, that's what I have here. I'm going to be doing a head-to-toe assessment on you today.
Okay.
Have you ever had one of those before?
Yes.
Okay. I'm going to explain to you what we're going to be doing. We're going to... I'm going to start with the top of your head. We're going to inspect your hair.
Okay.
We're going to start there, and then we're going to get all the way down to the bottom of your feet.
Okay.
We're going to look at your hair, from your hair all the way down to your feet. We're going to listen to your lungs, your heart. We're going to look at your skin. It can get a little uncomfortable at times, but that should be okay. I'll try to give you as much privacy as possible during the whole procedure.
Okay.
And only open up what I need to see when I need to see it, okay?
Okay.
So let's start with your hair.
Okay.
If I can help you get to the side of the bed here.
Thank you. Can you set those on the table for me?
I sure can.
Thanks.
Could you tell me the date that it is today?
Yes, today is July 12th, 2019.
Okay. And do you know where you are?
State Fair.
Okay.
Lab.
Okay. And do you know why you're here?
For an assessment.
Okay. And can you tell me the day of the week?
It's Friday.
Okay, so the client is alert and oriented ×3. She has a good posture. How old are you?
34.
Okay, so I have a 34-year-old patient whose overall height is around 53 inches tall, or 63 inches tall, and she is overweight for her height and weight, or height and age. But her posture is good. Her overall care of her body and looks good. She's clean, and her appearance looks well kept. I'm going to look at your hair.
Okay.
Okay. What we're checking for is lumps and bumps. I don't feel any bumps on your head. Okay. I'm going to inspect your hair further. I don't see anything here behind your ear. Do you have any itching or anything with your scalp?
No.
Okay. Your hair is nice and it's non-oily. It's got a good texture to it. It's not too dry. It's actually got a nice texture. It's very full in the back. Some thinning in the front. Other than that, it looks very good. I'm going to, if we can remove your glasses, we're going to look at your face. So your face is oval shaped, very symmetrical. Your eyes are symmetrical with your ears. The points of your eyes come out to the tops of your ears, which is where we want them. Your nose is midline to your face, lining up with your mouth and your chin. Your skin is nice and warm, and your cheeks are pink like they should be. Your skin on your face is not too dry. It's not moist either, or not super moist either. Somewhere right in the middle where we would like it to be. Let's look at your eyes, okay? Your pupils are equal in size and round. Your sclera is white. I'm going to look at your conjunctiva, okay? I don't see any nodules or anything, and your conjunctiva is dry and pink. Well, it's moist and pink. It's not, just doesn't have any drainage or things like that, okay? I'm going to do a light test. If you can look right there, I'm going to see how your pupils react to light, okay? Okay, that goes from about a 2 to a 1. Again, from about a 2 to a 1, so pupils are equal and reactive to light. If you could, I would like you to follow the top of my pen with your eyes. Only your eyes, do not move your head, okay?
Okay.
Okay? Right now we're going to do accommodation. I'm going to follow it from here all the way into your nose. Very good, thank you very much. All right, I'm going to check your ears. Does this hurt when I touch your ears? We're going to palpate your ears like this.
No.
No? Have you had any noticeable drainage or pain in your ears?
Mm-mm.
Okay, I'm going to just check in your ears. Okay, there's no drainage in the ears, no extra wax or anything like that. Everything looks good. Okay, I'm going to move on to your nose. First I'm going to start palpating up here, and we're going to come right down the bridge of your nose. Septum feels nice. Okay. I'm going to do a test on your ears real quick, okay?
Okay.
I'm going to occlude this ear and do a hearing test. Can you hear that?
Mm-hmm.
Okay, now I'm going to occlude this ear and do this. Can you hear that?
Yes.
Okay. If you'll look up for me, I want to look inside your nose, okay?
Okay.
Okay, I don't see any drainage in your nose. Your nose is nice and moist on the inside, but no visible, it's not super dry. The septum is still in place where it should be. Do you feel any pain here when I touch right there?
No.
Okay. Do you feel any pain here?
No.
Okay, I'm going to come down here. Everything looks good. If you can put one finger right here
Mm-hmm.
and breathe in through your nostril. Okay, now do the same thing for the other side. Okay, there's no occlusion to either nostril. Now, her lips are pink and moist, so no signs of dehydration thus far. Open your mouth for me. I can see the inside of her lips, which look good. Inside her mouth is nice and moist. No sores. Stick your tongue out for me. Under the tongue looked good. Stick your tongue out and say ah. The back of the throat looks nice and clean, and there's no sores on your tonsils, and the uvula is straight down the midline.
Okay, awesome.
Okay, where it should be. All right.
Okay.
So we're going to move on to your throat. While I have you, if you can just look forward for me real quick. I need you to smile for me. Okay, and can you do a frown? Okay. So her symmetry in her face is even when she smiles and when she frowns. Stick your tongue out for me. I see no noticeable facial drooping. Her tongue is midline. Okay. I'm gonna palpate your throat and your neck. Okay.
Okay.
So the skin on her neck is warm. I feel no swelling in the neck. Does this hurt at all?
Mm-mm.
Okay. Everything looks good, feels good. All right. Now I'm going to have you lift your neck up just a little bit. So I'm going to feel down your trachea.
Mm-hmm.
Trachea is midline to the neck with no visible or palpable lumps or anything along the trachea. What I want to do is I want to listen to your next to your trachea. I'm going to listen to your carotid pulses, and I'm listening for a bruit. Okay.
Okay.
I'm going to need you to hold your breath while I listen. Okay. Hold your breath. Okay. Okay, go ahead and breathe. All right, now I'm going to raise the bed up so I can look at your arms. I'm right in front of you, so everything should be just fine.
Okay.
Skin on your arms looks good. Does any of this bother you? Can you feel this?
Mm-mm.
You can feel it?
Yeah, I can feel it.
Okay. All right, let's extend your arm out. Bring it in. No crepitus noted. Rotate your wrist for me. Very good rotation. Okay. Skin turgor is good. Okay. Capillary refill is good. Bring it out. Bring it in for me. No crepitus noted. Rotate that wrist again. Okay. Cap refill is good on this one. Pulses are good here. Pulses are 2+ and equal here. Okay, if you can pull forward pull against me. Okay, now push against me. There you go. Now, can you squeeze my fingers? Very good. Okay. Now go ahead and I'm going to listen to your chest, okay?
Mm-hmm.
I'm going to listen to the front part of your chest, and then I'm going to move around to your back side.
Would it be easier if I took off my shirt because I have an undershirt on?
If you're more comfortable doing that, yes, we can do that.
Okay. There you go.
Okay. So what I'm going to do is I'm going to listen to the top part of your lungs first, okay?
Okay.
And then I'm going to listen to your heart. I'm going to go underneath your shirt and in between your breasts, okay?
Okay.
And then I'm going to listen to your apical pulse for 1 full minute.
Okay.
Okay? Your apical pulse is 66. Sounds very good. I'm going to listen to it with the bell now. Okay?
Okay.
This enables me to hear more in-depth sounds, okay?
Mm-hmm.
I'm going to go again in between and underneath. Okay. I'm going to go, you feel comfortable right here on the side of the bed?
Yes, I do.
Okay, so I'm going to go around and I'm going to go to your backside and I'm going to listen to your lungs on your backside and I'm going to palpate your kidney area and your spinal column, okay?
Do you want me to turn sideways?
You can turn a little sideways. I'm still going to come along your backside.
Okay.
Oh, you've turned all the way around. Look at you.
How? I just do that.
Okay. So you have very good range of motion and are able to move around quite well. So I'm going to lift up the back of your shirt, okay?
Okay.
If that's all right with you.
Yes, that's fine.
Okay. The skin on her back is good. There's no lesions. It's pink, non-moist. It's nice and tender or non-tender. I'm going to go down your spine here. Do you feel any
No.
Pain?
No.
No? Okay, how about in your kidney area? No pain there?
No.
How about when I do that?
No.
No? How about here? Any pain or tenderness?
No.
No? Okay. I'm going to listen to your lungs. Take a
Okay.
deep breath each time you feel the stethoscope touch your back, okay?
Okay.
Now one more. Okay. Everything looks good on your backside. Okay.
Okay.
Now I'm going to help you to lay back down so I can assess your abdomen. Okay.
Okay.
Okay, go ahead and lay down. Yeah. Okay. I'm going to go ahead and lay you back. Wrong button.
I did that earlier.
Are you comfortable?
Yes.
Okay. So, I'm going to lift up your shirt just so I can have access to your abdomen.
Okay.
The abdomen looks good. I'm going to pull you down just a little bit so I can have access to your lower abdomen. Okay, there we go. Okay, sorry.
You're fine.
Okay, so I'm going to listen to your mouth sounds.
Okay.
Okay? Vowel sounds are active. And equal in all 4 quadrants. I'm going to listen to the vascular sounds, okay?
Mm-hmm.
Okay?
Sorry.
Okay. Okay, now if you don't mind, I'm going to pull down your shirt for this because I don't need it up, but I'm going to palpate your abdomen, okay?
Okay.
If at any time you feel any discomfort, just let me know, and I will go ahead and stop palpating your abdomen, okay?
Okay.
I need to know, before I do this, have you had any signs and symptoms of, or a history of bladder retention?
No.
So if you go to the bathroom, you don't ever feel like your bladder is still full, or you have to go right again
No.
shortly after going to the bathroom?
Mm-mm.
Okay. Okay, you feel any discomfort?
No.
No? Okay, first quadrant done. Second quadrant done. No discomfort?
Nope.
Okay. Okay, go into the big area. No discomfort here?
Nope.
So everything looks good. I don't feel any lumps, bumps, or nodules. We'll go ahead and pull your pants back up here to a comfort level for you.
Thank you.
Okay? Keep you nice and covered. I'm gonna go ahead and move on to your legs,
Okay.
okay? I'm gonna pull your pant legs up just to above your knees, so I can assess those pulses behind your knees there that are hiding back there. Okay?
Okay.
We'll start by those. Okay, you have 2+ pulses behind your knees. Those are called popliteal pulses.
Okay.
Okay, those are good. I'm just gonna move your stuff over to this chair, okay?
Okay, that's perfectly fine.
And then the tibial pulses are 2+. Pedal pulses are 2+ as well. Cap refill on the toes is greater than 3 seconds, or less than 3 seconds. Feet look good. Hair on the legs is evenly distributed. Can you feel this? Light touch. Okay. Blanche test is good. Return to normal color quickly. We're going to do a range of motion on your legs, okay? We're going to do a range of motion on your legs. We're going to bring it up and then out. Let me know if you feel any discomfort.
No, feels
How
good.
was that? Okay, let's do this one. Bring it up and then out. Any discomfort?
Nope.
Okay. All right. Now what I want you to do is that I want you to pull your feet up against. Okay, now push them back. Okay, now I want you to lift your legs up against my hands. Very good. Okay, there's no edema noted in the ankles or the feet. Can you rotate your ankles for me? Very good. Okay. We're gonna pull your pant legs down. I'm gonna lower the bed and I'm gonna bring you to the side.
Okay.
And I want you to stand and we're gonna have you walk for me towards that curtain
Okay.
and back so I can assess your gait. Okay?
Okay.
You'll turn this way. We put non-slip socks on you so you can walk. Okay? If you'll stand up for me and walk towards that way. And then turn around and come back. Gait is normal. Patient needs no assistance with walking. Has a steady gait. Toes pointed forward, knees pointed forward, no slouching. Posture is good. I noted when she's sitting up, there's no leaning to one side or another, no barrel chest when she's breathing, and even and unlabored breaths. Patient is doing well, has a good mood and affect, was able to answer my questions without any issues, alert and oriented ×3, and ready for the doctor to come in and see her. Did you have any questions for me?
No.
Okay. The doctor will be right in, okay?
Okay, thank you.